Good morning and welcome to our speaker series. So glad that you could join us and very excited about our program today. For those who I haven't met, I'm Keith Forrester, Vice President of Marketing, Sales, and Business Development at Kaiser Permanente. And I'll be serving as your host today and glad to do that as we work through and talk with our panelists and have a really good discussion, I think, that's relevant to businesses today. So really looking forward to that. And as you were in the room kind of waiting for this, you saw some videos that have been put together with Dr. Scharf, and those are available to you on YouTube. And we'll put those links in the chat that you have. And it's just an important part of what Kaiser Permanente is doing to do some myth busting around vaccines and really promote the vaccination rate. Certainly within the Northwest for Kaiser Permanente members, but really for everyone to make our community that much more healthy. And will be part of our conversation today. A few housekeeping items as we get started. I encourage you to participate. You can do that through the chat function. So we'll be monitoring that. So as questions come up, if you could put those in there, we'll work it in as many as we can, sometimes sprinkled throughout our conversation today. Other times we'll also have time for a Q&A at the end. Now, as a reminder, I'm sure you've been through these webinars a number of times, but with this size of an audience, you are muted. But again, type in those questions and those will be funneled to me so we can work those in through our time this morning. Now, joining me for today is our Chief Operating Officer, Wendy Watson. And as you can see her bio here, she has been with Kaiser Permanente since 1993. But so I want to welcome Wendy here and really glad that she could lead this conversation with Jessica, who you will meet later, and also with Dr. Spindel to start us off. So welcome, Wendy. And people can see your bio there. I guess I'll just ask you a question. What do you like to do when you're not working tirelessly and endlessly on COVID? When you have a moment of free time, what would you like to do?
Oh, that's a great question. Free time. Not a lot of that these days. I would say for myself personally, in terms of staying sane and my own well-being, is running. That's my therapeutic activity. And then on the personal side, my family, my kids, my husband, our animals, that keeps me sane as well.
Yeah. So important that we keep that going as much as we can, particularly all the stresses that we have, particularly over the last 20 months. So with that, thrilled to have you today, and maybe you could introduce our other panelists.
Yeah, I would love to do that. So two leaders joining us today, I'm very excited to introduce. First is Jessica Carbullido. She is the Columbia Sportswear Vice President of Total Rewards and HR Operations. And then Dr. Steve Spindel, who is our Kaiser Permanente Regional Chief of Infectious Disease. So very excited to spend some time talking with both of them today.
Looking forward to it. So why don't I walk through the agenda, which is very simple today. So not a complicated agenda. A few key things that we want to go deep on. First, we will, because this is so important, is provide a relatively brief update on COVID-19 and vaccines. Now, just to do a further advertisement, we are going to have another speaker series on Friday, October 1st, where we will delve more deeply, specifically into COVID-19, just as we've done over the past 20 months. So I want you to mark it on your calendar. Again, Friday, October 1st, and that'll be at 9 a.m. We haven't sent out any links on that, but we'll get the message out to you fairly soon. But the next part is really, it's our conversation with Jessica, as Wendy had mentioned. And here, we're really looking at this from several dimensions. First of all, from Kaiser Permanente, we really see that our fundamental work within group business is to help businesses be more successful. We really want to align with what's the company's business strategy. At the heart of that, its sub-element will be their benefits, but it's wider than that, of how do you have a healthy, engaged, knowledgeable workforce. And so in that effort, we want to make sure that we're listening and understanding what's driving companies in the Northwest and across the nation. What are their concerns? What are they trying to do from a people standpoint as well around productivity, engagement, and what are the themes that are important to them in doing that? And so as part of that process of us listening and understanding so that we can be more effective, we wanted to host a conversation on that. And we wanted to do that. And thanks to Jessica in advance for willing to be brave and join us, but really wanted to have a conversation around many aspects of the Columbia strategy as well as just their people strategy. So we'll just enjoy that conversation. So you can see the upcoming events that are listed here, and you'll have you can find more information at kp.org/coronavirus, and also through your sales and account management staff. So with that, what I'll do is I'll turn this over to you, Wendy, and you can get us started, and we'll start with the COVID vaccine information and update.
Great, thanks, Keith. So knowing that COVID-19 and the Delta variant is top of mind for all of us, we thought we'd start off today's session with a discussion with Dr. Steve Spindel. Dr. Spindel and I have been working very closely together since the beginning of this pandemic, and he's been a wealth of knowledge and just a fantastic expert guiding us through this. So Dr. Spindel, I'm going to start with the first question, just a broad kind of opener. Can you give us an overview of current state of COVID-19 and Delta, and maybe include something in that our audience wouldn't necessarily hear on the news?
Sure. Thank you, Wendy. So this slide that you're looking at is a little bit dated. This COVID-19 pandemic has moved very quickly through the globe in our communities. And so from mid-July, 370 million vaccine doses given in the U.S. is up to 460 million. More than, let's see, the number is 5.7 billion vaccine doses have been given worldwide. The percentage of people 12 and over in the U.S. who have had at least one vaccine dose is still in that high 70% range, possibly because people are still completing their series. And so the number doesn't necessarily always rise right away. The status of the COVID pandemic is the country and our Northwest region is going through another surge right now. We're at the peak of the surge. And the surge is primarily occurring because this virus is doing what it wants in an unfortunately unvaccinated and susceptible population that then spills over to those who have even been vaccinated.
Great, thank you. So as you look out on the horizon, looking out the rest of this year into 2022 and beyond, what has you worried and what makes you feel hopeful?
What has me worried is just the ability of the virus to mutate and generate new strains that are variants, right? So you've heard a lot about variants in the lay media, on social media from your healthcare professionals, and many people may not still understand what a variant means. And so as any organism survives and reproduces and replicates and goes forward, mutations will occur by chance. And when mutations are not advantageous, then that specific strain doesn't carry forward. When the mutation provides a survival advantage, then it does carry forward and spread. And if the mutation is such that it increases the ability of the organism to transmit and cause severe disease, maybe have higher levels in an infected person, that's what brings about variants of interest and then variants of concern. Variants of concern, as you've heard the CDC refer to or in the lay press, are ones where we really have to pay attention to the fact that it is transmitted easier, that it causes more severe disease and hospitalization and death, and can cause greater outbreaks as time goes on. So the Delta variant has been the latest of the variants that we've seen, and it does exactly that. It infects more people. It's twice as transmissible. It causes more disease. But we do know that the vaccines that we have in production today are efficacious. The problem with the messaging is, what is vaccine efficacy? You hear people describe all sorts of things and show all sorts of graphs and tables that may indicate that there is vaccine efficacy, in other words, protection against the virus and the Delta variant when you get the currently available vaccines. And then you see graphs and tables that say the opposite. And it can be really hard to sort out through that data and decide what is happening. But here is what we really know. When you really look at the available data, and the data comes out, publications come out every week, actually every day, but at least every week. And we know that the current vaccines protect against serious disease, hospitalization, and death. We see the efficacy of the vaccine drop somewhat when you talk about all cases, which would include asymptomatic and mild infections. And so that may be because of time since we've started vaccinating people, or it may be the ability of the virus to spread quicker. And so, that's variance, and that's what worries me. We currently have the Delta variant. We have to see exactly what the impact of the Delta variant will be on the country in our Northwest region as the next month or two go on. Will our spike completely come back down to normal, or will it achieve a new higher baseline? And then I worry about future variants. As long as you have people not immune, in other words, not vaccinated, not fully vaccinated, we will see strains evolve and variants emerge that could be just as dangerous or more dangerous. We need to get people vaccinated. What I'm hopeful about is that I think people are beginning to see the message about getting vaccinated and the advantages it has. We have safe and we have effective vaccines. And I think slowly but surely, we are capturing more people who understand that and who will willingly, for themselves, for their family members, for their coworkers, for their community, and for the good of the nation and the globe, get vaccinated. The other piece of that is, of course, mandates, which we'll get to, I believe, a little bit later.
Great, thank you. So I'm going to turn it over to you, Keith, because I think we're going to shift roles here.
Yeah, before we do though, I just, Wendy, in your role here, you're in a unique place in terms of overseeing thousands of employees. So as an employer, but also they're in the healthcare industry, which is front and center with COVID. So what do you see as some of your most important actions? I mean, we get the idea we need to support vaccination and encourage that. And so how's that impacting your prioritization in terms of what you do to support vaccinations?
Well, I'd say there's three top priorities for us right now at Kaiser Permanente. First is getting everyone vaccinated. That's our entire workforce and all of our membership for all of the reasons Dr. Spindel just stated. That's number one. Second is, addressing all of the care needs of our members right now. In addition to the COVID surge that we're seeing, we have pent up and deferred care from the past 18 months that we're trying to take care of, as well as just ongoing care needs. So there's very high demand right now, and we're trying to make sure that we're meeting everyone's needs. And then on top of that, the healthcare workforce, frankly, is exhausted and burnt out. And so we're also trying to really invest in our workforce and make sure that they feel supported by us as leaders and that they have the resources that they need to continue to fight this pandemic.
Yeah, I mean, all of those are so important, and I think they really do lead us to the next question, which is, this is not just about Kaiser Permanente, but employers in the Northwest and around the country. This has been going on for over 20 months. It's impacting the morale, certainly in healthcare, but also for just a variety of employers. So with that, I guess I'd just be eager to hear your conversation with Jessica and how that's shaped and influencing Columbia.
Agreed. Ready to shift to that now?
Yeah, I'll turn it over to you.
Okay. All right. So Jessica, I'm excited to get going with our discussion. I have all kinds of questions queued up for you. But to start, I just had to share something with you. So I was having dinner with my 16-year-old last night, and I told her that I was interviewing an executive with Columbia Sportswear today. She and I happen to have a lot of Columbia Sportswear items in our closets. So, and we were talking about Gert Boyle and the start of Columbia Sportswear and just the inspiring story. Anyway, this morning I made it to her Instagram story this morning, and it is not often that I am viewed as cool in the eyes of my 16-year-old. So I just wanted to thank you for that opportunity.
That's awesome. I wish I was cool in the eyes of my 16-year-old daughter.
All right. So to start, why don't you tell us a little bit about yourself, and also just share how are you and your family doing as we get through this pandemic?
Sure. Obviously, as I've been introduced, as the Vice President of Total Rewards and HR Operations for Columbia Sportswear, and I am extremely excited to be here, and I appreciate you having me here to share some of the Columbia Sportswear story. Me personally, I've been with Columbia for about 3.5 years now, and more than half of that has basically been devoted to COVID response. In leading Total Rewards and HR operations, we focus on well-being, which I think is a really awesome bit of, in alignment with my passion for making companies, employees of companies very, just love where they work, right? I've worked in transportation, I've worked in tech, I've worked in insurance, and now in retail. It's the same story everywhere I go. I have a passion for making employees love where they are. And in terms of faring through the pandemic with my family, we've all been at home. I have a 9-year-old and a 13-year-old and a 16-year-old. And then the 9-year-old is a video bomber. She likes to jump into a lot of my conversations. So it's interesting as I'm on calls a lot. That's why I'm in the office today to have this. But from the standpoint, we're out all the time. That's another thing I love about Columbia. It's an outdoor company, but we're out. I'm a softball coach, so we are able to get out a lot. That is one sport that has been able to continue through most of the pandemic. So my little one, we are out all the time practicing and playing and watching the older ones play soccer. But it's been interesting and rough having everybody at home in school. It's great to have everybody back this year.
Yeah, I think you're definitely painting the picture of all those who've had to go remote and try to figure out how to balance that with family.
Mm-hmm.
So I remember distinctly exactly where I was standing the moment I heard about the first Oregon COVID case at our Kaiser Westside Hospital. I'm curious, what's your memory of when COVID first became real for you?
I remember the day that was announced, and I remember debates about this is just starting. It's going to be a long track, and then others going, no. We'll be able to handle this. But then very quickly, within just a couple of weeks, everybody went home, right? It was things just happened so fast.
That's for sure. I don't think any of us knew how big and how long we were going to be in this. So I've been seeing Tim Boyle in the news a lot lately, out there really encouraging vaccinations, which is great. Very excited that both Kaiser Permanente and Columbia Sportswear are out there with this critically important message. Why is it important to Columbia Sportswear and to you to encourage vaccination of your employees?
Really for us, it's about the safety of our employees and our workforce and continuing to stand strong for the entire country and world as we move through this. I mean, Tim wants people back in the office. He wants people to collaborate together, and he's been pretty vocal about that within the company for quite a while. So this from Biden and the president's office has been really great for us to just really support the message that he feels so strongly about in terms of getting people back.
That's great. Yeah, it's exciting to see there's some important conversation, it looked like today, with Biden on the front. So looking forward to what comes out of that. So let's talk a little bit about Columbia Sportswear. What are some of your top maybe 2 to 3 corporate strategies? And then for you as the HR leader, what are some of your maybe top 2 to 3 strategies for the near term for HR?
So for Columbia Sportswear, our biggest strategic kind of growth is within the retail space. We have been mostly going through providers in the past, and now we're looking to really grow our retail, direct to consumer retail, and then also really grow our e-com space. That's another thing that we've been a little bit slower at. So those are really focused areas for us right now. And even as within HR, we're trying to tie everything that we do into both of those things. We need to be set up to help the business grow the retail side. And we also need to create our digital strategy in a way that really reaches everybody, especially as people are at home right now. Digital is so important for us, both in the business side as well as the HR side.
Yeah, for sure. I've been so impressed with the focus of well-being in Columbia Sportswear, which really was pre-pandemic. Why is this such a core strategy for you, and how has that shifted over the last 18 months as we've been going through COVID?
I would say in terms of core strategy for me, when I came into this company, I remember during my interview, I said, well, if connecting active people with their passions is the mission statement for the company, where is well-being in that? And the answer was, good question. So when I came in, one of the first things that we did, I have a great team of people, and my well-being manager, or my well-being program person at the time, had a vision that was just like mine, which was, how do we tie total rewards and well-being together into the mission of the company? So we started that the end of my first year there, we rolled out our total rewards philosophy, which was structured around the 5 pillars of well-being. And we have really tried since then to focus on each of those 5 pillars globally. So we rolled that out globally since then. Now that set us up a bit as we were going into COVID, because we're focusing on the safety and security of our employees. So we're really able to focus on, that pillar was really important to us. And it's been a trek and a journey. But for me, that was super exciting to be able to tie well-being, helping employees love where they work, into the strategy of the business.
Sounds like a perfect blend of your passion with Columbia Sportswear. That's fantastic. So I saw the news that Columbia Sportswear was selected by Forbes as America's best large employer in 2021 in the clothing, shoes, and sports equipment industry. Mm-hmm. That is an amazing accomplishment in any year, let alone mm-hmm. in the middle of a pandemic. So I'm curious, can you share with me and with the audience, what do you believe are some of the things that you did to deserve that award?
I think the continuous focus on well-being of our employees has been a big driver. We're not perfect. Nobody's perfect out there, but we constantly try, and we try to listen to our employees. That's been, something that is a focus, and we're going to continue to get better and better at that. But I think really it's just the fact that we've been focusing on our employees, and we have even people sometimes that leave are positive about the experience that they had here. They're leaving for different reasons. And that's, all the way from our retail staff to our distribution staff to our office staff. I mean, we try really hard to listen and grow our people strategy in that way.
What do you think Columbia Sportswear might be doing differently than other employers? As I know, lots of companies focus on well-being. What do you think sets you apart in this regard?
I honestly, I don't know, because I feel like we are always trying to be better, and we're always trying to learn from others. I mean, I think we're just grateful that we do have employees that respect us and feel like we are trying to listen. We're trying to figure out what does make us different and better, but we know we have a lot of room to grow, and we're going to keep working on that.
That's very inspiring. What do you believe others could learn from you in terms of partnerships you've forged and steps that you have taken to improve well-being?
I think the biggest thing for us is about creating those partnerships with those inside and outside the company, really trying to inspire employees and inspire leaders to push for these things that are important. I know as soon as the pandemic hit, we started thinking about things like, how are our employees going to be cared for and feel cared for in a space where they're at home, they no longer have these personal relationships. What are those things that matter most? And I know a lot of companies stood up care-based programs and put pay programs in place and things like that. But we jumped really quickly tried to partner with different groups. We partnered a lot with our brokers and just our existing vendors to see what information they could share and were willing to share. We talked a lot with them and really just tried to learn and grow even in that moment.
Wendy, I wonder, and Jessica, I wonder if I could jump in here. So, as you were mentioning, listening to employees, and I think that's always critical, and something we're trying to do, and so many companies are trying to do that. And as you did that over the last 20 months, what would you say came out as being that stood out more than maybe what you had seen previously? Relative to HR in terms of maybe what their needs are, particularly around that theme of well-being, if anything came through. And just before you answer that, just remind people, go ahead and use the chat function and send us questions, but curious what might have emerged, Jessica, that was new.
I think I put this into a bit of a well-being bucket, but one of the things that we heard a lot about was the kind of our DEI strategy and where we were going with that and what we were going to do. Because during the pandemic, we had all of this other unrest that happened. So that really is one of the things that popped out for us. And we stood up, employee resource groups and things like that in that space. But the other thing was just, people saying they wanted to hear it, wanted to see that we were listening. So we tried to focus on listening and then sharing back what we had heard and showing that we had listened, right? Really putting our words to action.
Yeah, I'd say that really resonates with us, and that invite Wendy. But as we were managing our workforce, just that need to accelerate our listening, showing that we're heard, because in so many ways we didn't have the solutions to these things, whether it was the racial unrest that was taking place, the civil unrest, whether it be, and then people working remotely and having children at home, and we're trying to do that among COVID. The need to listen and empathize, I think, from the company and be more understanding was really coming through to us in ways we hadn't seen.
Yeah, I agree. And, what we found too was things were changing so rapidly, and there was just no way to really get information out in the traditional ways that we had been communicating. So, some of the strategies we took as well are very frequent audio casts with all employees. Dr. Spindel was a frequent guest speaker on that, just sharing the latest on what we knew. We implemented what we called tier huddles, all the way from frontline teams on up to senior leaders meeting every day, sharing information, hearing questions and feedback. And what we really found was just a stronger connection throughout the organization, just because we were all navigating this and trying to manage it together. Okay, Keith, anything else, or are you okay if I move on?
Yeah, go ahead and move on. That was good.
Okay. All right. So shifting gears just a little bit, Jessica. So many people right now are thinking about changing jobs. I've seen lots of polls out there, and we're seeing it in healthcare as well. I think the pandemic has had a big impact on people and how they think about their work and how they want to spend their time. So knowing that, and knowing many employers are focusing on well-being, what would you say are the most critical components of well-being that have to be focused on in order to be successful in this area?
I think a lot of it's their employees' social health, knowing and helping them build relationships, even though we are remote. Again, to me, it always goes back to listening and really hoping to build a strategy that gets employees to love where they are. I mean, the big, everybody leaving right now. This is happening. Everybody's aware of it. We're aware of it. We're nervous that we're going to lose a lot of people, and we have lost some. But we just have to keep focusing on the ones that are staying and do our best to make them happy, so that they will want to stay, and that the people that we bring in we're bringing in with a passion for what they're doing and what we're about, so that they'll stick around.
Are there strategies that you can think of that we can do together, really across organizations, to help address this? Because it is really something I think every organization is facing today.
Yeah, I think from a strategy perspective, again, it goes back to really just focusing on them. we have to listen. We have to hear what it is that they need, and we have to operationalize it, because the more that we listen and don't act, the more people are going to be unhappy. I don't think that this is going to go away soon. I think it's something that we need to continue to focus on, and just really focus hard on over the next, 6 to 12 months, and then probably into the future differently than we have before.
Yeah, we've been thinking about that as well. I kind of view this as this may be the long tail post-pandemic that really changes the face of the workforce. And we're looking at things like workforce development. How do we help people evolve into different roles if what they're doing today is something that perhaps they don't want to do any longer, in partnerships with schools? And so I think one of the silver linings of COVID is it's really brought different players and partners together to tackle the various challenges that it's brought.
Yeah, and we are focusing on mobility as well, trying to grow that team. We don't have a lot of it today, but we celebrate every time we bring somebody into a new role just because of that.
All right, well, so let's talk a little bit about an aspect of people strategy, so behavioral health. The pandemic has really changed how employees look at their own jobs, and also how we as employers communicate with our employees. So what are some of your guiding principles within Columbia Sportswear for communicating, especially with much more of a remote workforce now?
So one of the things that we had started doing, particularly at the beginning of COVID, was trying to communicate often and educate a lot. So we were, for quite a while, sending out communications at least once a week with information. And we were having to be very careful, as I'm sure most employers are, about the audiences that we were talking to, because our retail audience gets reached differently than our distribution center audience, differently than our corporate office audience, and then even our global audience. So we have been working really hard on understanding our audiences, understanding the venues that we have for communicating. And right now we're doing it without a basic platform to be able to share information. So it's been a lot of work, but we are in the process of getting a platform to be able to make that simpler.
And what are you doing to support employees in helping them manage their own well-being as well?
So we have set up a lot of things. Some of them were in effect before as part of our just general well-being strategy, but we had very quickly, we used to have on-site classes, as many companies do, like fitness classes and boot camps and things like that, as well as cooking classes and even financial health classes. We moved those all remotely very quickly. We took some of our teachers that were in office and we made those classes remote, and we even started trying to record to make them available globally. And then we put cooking classes online so people would be able to attend those virtually. And then we had, one of the things about our culture that has always been really great is that every Thursday during the summer, we have what we call partios, which is a party on the patio. So anybody that's around the corporate space can come in, and it's a great time for people to just take a few minutes and say hi. Well, we haven't been able to continue those. My team, for example, does. We do a virtual partio every Thursday afternoon, and just giving people a chance to see other spaces. So we share those kinds of ideas too, and are able to then, share what's going on in the community, what's going on around the office, and then just chat, which is something we think people need in that social space.
Yeah, that strong desire for connection. Well, it sounds fun. I think I want to come join some of your parties.
Come on in.
How about your benefit strategy? Have you made any changes to benefit strategy to incorporate wellness and impact from the pandemic?
So yeah, we've really started, even again, pre-pandemic, we started to really talk about how do we bring the strategic focus that we've been sharing into the decision-making up front. So we've asked this year in particular to really put in place, let's talk well-being. Let's talk about every possible change that we can make in our benefit plan that is, and how it is in service to that, how it's in service to DE&I, how it's in service to some of these other things that we've been talking about, like social health and employee and behavioral health and all of that. We want to see how each one of our benefits decisions is in service to those, to make sure that we're making the right decisions for our employees.
Great. So how about equity, inclusion, and diversity? So that's obviously a topic that has risen to the forefront in our homes, in our communities, and in the workplace. What are some of the approaches you're taking at Columbia Sportswear around EID?
Well, we, as I mentioned, with the unrest that was happening kind of during the middle of the pandemic, we quickly had moved forward some things that were already in the pipeline, like standing up a DEI leadership team. We now have very strong employee resource groups. Actually, they all presented this morning to the leadership team, which was great. They're really focused on bringing employees along. So it's one more forum for employees, as ERGs are intended to do, right? For employees to be a part of the company, feel like they can talk about those things that are important to them and really embed them into who we are as a company.
Do you believe you can have an inclusive workforce without a focus on well-being?
No, I don't personally. I think you have to focus on people and well-being and making people feel good, just feel good, or nobody's going to feel like they're a part of it. That this is something that, for me, I mean, years ago I was working in when it was more focused on diversity and inclusion versus the equity piece that's come in more recently. I really focused on inclusion. I mean, to me, you have to have inclusion in order to get diversity and equity. So I do think well-being is a massive part of that.
How are you partnering with Kaiser Permanente to translate EID into your benefit strategy?
So that's one of the things we have asked this year our broker to do in terms of working with Kaiser and other providers, and just making sure that everything that they're presenting to us is, like I said, under that lens. We want to know that what is available from a DE&I perspective, and what is it that we have, how is what we have showing up from a DEI perspective.
That's great. Well, we're definitely looking forward to partnering with you on that.
Hey, Wendy, could I just jump in? So hate to do that, but a couple of questions that have kind of come in, and it's really, some of them are around the how. So just to pause there, really, because you've talked about listening. One was, so the two questions I'll just give you. One is, how are you survey or listening to your employees? Is that through multiple channels? Is it primarily through like a email survey, or are they focus groups? And then how are you starting to incorporate the inclusion in the way that Columbia conducts its business internally? What's that start to look like? It's, we're all on a journey, and we're not at the end goal. I don't know if we'll ever be there, but what are you starting to see in terms of how that's changing the way that you work at Columbia?
So I think I already forgot your first question. I'll start with the second one. The inclusion, we've really been trying hard to bring lots of people along. So making sure that teams are really collaborating and communicating about all pieces. I'm also the sponsor for the Women's Leadership ERG. So, they have tons of great information. That's the group that's been in place the longest. It was an ERG before we had ERGs. And they have so much great insight. They've got the largest reach in our company right now, and they have ideas that need to be percolated up, and then they need to be included in those conversations. So, for example, one item is our leave of absence. We have had some struggles because we've got such diverse populations, and our parent group in the Women's Leadership ERG said, we're struggling. We're hearing feedback out in our regions and out in our different distribution, retail, and all the different spaces about how that leave process is going. So right off the bat, we said, let's bring that group in and have them be a part of our new request for proposal. Let's get their feedback. Let's include them, and let's actually take their voices as part of this process.
Yeah, that's a great example, bringing those folks in who have voiced those concerns to help craft a solution.
Yeah, and your first question, it fleeted back in a minute. Can you repeat that one again?
Sure. It was just if there's more specifics on how you're maybe changing the way that you have to listen, or that you choose to listen to employees through surveys or focus groups or a combination.
Yeah, so we've been doing surveys for a while, but we kind of re-upped our survey recently. So we've got now a great baseline for our employee survey it has new DE&I focused questions. But we also are doing things like we've got focus group plans for our new communications portal, for example, which is for me, that's a really important step, something I've done at other companies that we're working hard on building in here more often. And then also to the point of like the Women's Leadership Initiative group, a lot of our different groups have information. So again, just bringing that in, taking it in from every channel we can, and not being stuck on it being through a survey or through just a focus group. We want everything. That's the only way to truly listen.
Yeah, and one of the things, and I'll let you get back, Wendy, was you mentioned about the virtual classes. So are you using? I'm thinking that's pretty well received, but just to verify that, and then are you using vendors for that? I assume you are as well, but
yeah. So we're using vendors for our large employee engagement survey, definitely, and most of our focus groups at this point have been smaller internal. But yes, we've had lots of positive feedback, and our survey results actually were much better than I've seen at prior companies. So it was great. I mean, and to the earlier questions about how were we chosen as one of the Forbes best businesses, I mean, I think that speaks to it, right? We had great survey results.
Thank you a lot for allowing me to interrupt. Wendy, back to you.
No problem. That's great. So I actually just have one more aspect of people strategy that I want to hit on, and it's social health, another really important topic that many employers are talking about right now. So what does social health mean to you at Columbia Sportswear?
It's really about that interaction, employee interaction. And this is one of the places where Tim has been so vocal about the mandate, because he wants people together. He feels like we're going to be a better business if we are interacting on a regular basis. And so for us, it's about keeping employees connected. How do we do that in a way that makes sense and in a way that makes our employees feel, really empowered and enabled and able to do their best and be their best, both inside and outside of work?
Yeah, we're definitely, on a journey with social health as well, of recognizing, factors outside of medical, how food insecurity, all of those things having such an impact on medical as well. So it's great that we're focusing on that. How are you translating social health into your corporate strategy and your HR strategy?
We're still working on that. This is one of the places where we're still growing. I mean, I'd say it's something that we will continue to focus on and get better and better. But it is, I mean, to your point about other things, right? And Tim, maybe a couple of years ago, people would have seen in the news that Tim donated a large chunk of personal dollars to a downtown homeless shelter. And I mean, those are the things that we have. Our distribution center employees, some of them struggle with, the homes and food. And so, as a company, we do a lot to try to help out in the community. I mean, we've got that work that he's done personally, but then we also try to help with, food and things like that within the company and where those employees struggle.
That's great. That's another area where there's really just such great power in partnerships.
For sure.
Okay, well, I have tremendously enjoyed our dialogue, but I've been hogging you, so I am going to open it up, shift back to Keith, and I think we're going to go into just an open Q&A at this point.
Yes. So thank you. Well, Wendy, the first one, I'll actually go to you, because one of the things that Kaiser Permanente elected to do, and this was announced a while back, was mandating vaccines for their employees, and not just for those directly serving patients, but for all employees like myself and others. Can you say more about kind of what went into that decision, why that was made, and then I guess it's kind of the why, and then what are the implications now?
Yeah, so it's the COVID-19 vaccine is scientifically proven to reduce death and serious disease. So that first and foremost, we've been on the front lines of this pandemic caring for patients with COVID. So to have a vaccine to be able to protect ourselves and our patients, there's no better reason than to, require that folks get vaccinated. The other is we're seeing the painful impact of those who are not vaccinated now. Most of our hospitalizations now are those who are unvaccinated, and they're younger. The other side impact of that too is because of the surge associated with hospitalizations of the unvaccinated, we have had to again delay procedures for others for other medical care needs. And so for us, it's imperative that we get this pandemic under control so that we can continue to provide care for everyone. And I would say last but not least, we in healthcare operate under the first do no harm ethic. And so we have a moral obligation as we care for patients to vaccinate ourselves against preventable diseases, of which COVID-19 is included.
And I imagine while there's been pretty wide acceptance, it hasn't been total. So how have you and the team going to manage through that?
Yeah, I mean, we're facing same challenges as is being faced elsewhere. We're at about an 86% vaccination rate now, so we still have a ways to go. We have announced our vaccine mandate. It's really about just trying to meet people where they are, providing accurate, factual information, listening, finding out what are the fears, what are the concerns, how can we help address them. Certainly for those who have medical or religious exemptions, we're honoring that. But if not, then we're really just trying to help everyone get to the place of accepting being vaccinated.
We saw that healthcare was really on the cutting edge of the vaccine mandate for employees. But Jessica, as you know, it's spread beyond that now. So what were the considerations, I think, for the leadership team at Columbia as they weighed the options about how to support vaccinations as an employer?
For us, it was, getting people back to work, but being safe. So, we just went live with our mandate for office employees. It'll be effective early next year, unless the discussions today and going forward move it forward, which would be great. For us, it was just really about safety, needing to help not only keep our employees safe, but keep the community around us safe. So we actually ran a clinic as well in our parking lot. We partnered with some vendors to do that, and we got a lot of great feedback on that as well.
Yeah, that was great to see. Those who could do it, right? There was a lot of concentration at the Oregon Convention Center and standing that up, supporting that. And then as, that was able to spread, the supply of vaccine spread, we saw, employers and others really embrace this to try to get it more dispersed and easier to dispense for our population wherever they may be within our community. So, kudos to Columbia for doing that. Dr. Spindel, I want to go back to you. A question came in, and it has to do with herd immunity. So something we've heard of from time to time, and we know we're not going to likely get 100% vaccination, but what's kind of realistically possible? And is there a critical tipping point percentage-wise that kind of gets us to that herd immunity? I'm sure it's not, exact to the 10th decimal, but is there a general tipping point that's accepted around herd immunity?
That's been a moving target, primarily because this is a new virus, a new pandemic. We just haven't experienced this particular kind of virus or transmission before. Original estimates of 60 to 70% have now been bumped up to 80+%. Remember, it's not just vaccination percentage, but also those who have immunity from natural infection. It may be as high as 80 to 90%. The other thing to be cognizant of is when you're hearing and seeing statistics about the percent of persons vaccinated, they're all over the board. They may be all adults, they may be adults 18 and over, 12 and over, some states have 16 and over, and it's sometimes comparing apples to oranges. We may say that we have 74% or 79% of all eligible adults vaccinated when we mean that those over the age of 18 have had at least one vaccine. That's not enough. We need to include the adolescents that have been approved. We need to get the younger pediatric population vaccinated when that gets approved, whenever it comes in the next 3 to 5 months, let's say. We just need to see how fully vaccinated we can get everyone and immune to really be in a world where COVID-19 is just an occasional event, or maybe we see clusters like influenza, which is seasonal, and COVID-19 does not appear to be seasonal. But if I had to guess, I'd say 80 to 90%, where that number is fully vaccinated and the entire population. I think it's very clear that fully vaccinated is where we need to be, especially for these more virulent strains and variants that are here now and that will likely to come down the road to us.
Okay, so not having an exact number, but we know more is certainly better, and we're going to have to wrestle with the variants here. I mean, that's I think a big part of the unknown. It sounds like. Yeah. So Jessica, I want to go back to you. One of the things that we could spend more time on is, and I think particularly with a company of your size and larger companies, is the role of the manager. Certainly in well-being, but just also in keeping employees engaged. When they themselves are trying to get through this, it's hard enough for just a frontline person, but then you also have to support managers to support others through this. And I'm curious how that's impacted your work with your management team specifically and other managers in Columbia, what you've had to do to adjust to support those managers.
That's a great question. I was literally having this thought the other day where I've been trying to get, I mentioned the Vardios that we have, the virtual Vardios that my team does. I was thinking I'm trying, excuse me, to keep my team moving along. And what about me?
Right.
Excuse me.
You got to put on your own oxygen mask first, right? That's kind of
exactly, literally right now.
Yeah, you got to drink your own water first.
Of course that happened. But no, I was thinking about that because, it's not just me, but it's also my managers I know my managers have been going through a lot and they're trying to keep their employees engaged. And it's been hard. So, that's just my small team. And when we think about how the rest of the managers across the organization are faring, everybody needs to be brought along as an individual, not just like you as a manager need to bring your team along. You as a manager are an individual and you need to be brought along too and need to be supported. So it's something that I think we could do better at, but it's something that's definitely on our minds, I would say.
Yeah, we've just a little bit about kind of my team here locally within marketing, sales, and business development. Spent some time kind of thinking about this, and one of the things is just realizing from others we've got to create some space for some water cooler time, so that we've started our meetings rather than on the hour. They start 5 or 10 minutes after. People can come early, or they can just get some other work, so they're not back-to-back meetings, which we often will have an issue with it at Kaiser Permanente. So that creates that space, and for the managers and directors and others to be intentional about, we've got to make sure we're connecting with people about just not the work that has to get done, but that environment. We can be on, it happens with everyone, I think, is you're on a Teams call or a Zoom call, and a baby comes in, a child comes in, or the cat. But that's our new reality, and that's okay. We've got to create some space that's people are bringing their entire selves to work because their entire self is at their home often, and just being attentive, talking about that, supporting that can go a long way in giving people space so that they can get through this. So I think kind of what you were mentioning earlier is creating more time to listen, understand, and in doing that, even though we don't have particular answers at this time, nobody's been through a pandemic of this type or this duration in our generation, we can kind of get through that by creating a bit more space.
Yeah, I agree. And we really do try hard to do that. I mentioned that my 9-year-old likes to video bomb my calls. She hears people's voices and she comes running into the room and says, hi.
I would have liked that today. That would have been fun. Yeah.
That's why I came here. No, she's fun. No, but it's something that we talk about, right? We all joke about in our meetings too, when we do have our that space meeting where we can all just come and chat. Talk about those kinds of things to keep people engaged. For a while, and I haven't been doing this recently, which I'm actually now feeling really bad about, but for a while I was sending a joke of the day to most of my teams and even our entire HR team, just because we needed to keep people laughing. We we've got a lot going on around us. We need to take that space.
We found that we've used some of our team meetings to do some of that too, to think about how do we bring perspective, because some people are really good at creating having a perspective during times of change, and kind of feeding the managers and the team with that. Not something we always did a lot of before, but that can help us in this as well.
Kate, can I just add one thing? You know, I think
Sure,
it's interesting how social norms, I think, have changed. You know, I think in the beginning of all of this, you know, a photobomb from a child, we'd all be mortified. You know, just last night I was on a call and my cat walked in front of me, and, you know, I would have been just distraught a year and a half ago. I was like, oh, that's real now. I also think it's opened up people's more complete selves and lives too, you know, to be able to see those background environments and family and animals. And so that's another, you know, little side benefit that's come out of all of this as well.
I think so. It made me think too, Jessica, we took time for just a couple more questions here, but how do you see wellness then and well-being kind of changing over the next few years in terms of the more of the focuses that you'll have? And you've touched on some of this, but just wanted to go back there a little bit.
Yeah, I think in my mind, you know, we have been a company that's been very focused on people being together more often. I think that the well-being focus is going to shift. I think those things like video bombs and my cat jumping on my computer in meetings, those things are going to continue because we are going to have to be more focused in the future. I mean, a lot of companies on, you know, what percentage of your workforce is working remote, not, you know, do you have any, you know, individuals that aren't in the office? It's more going to be what percentage of your workforce isn't there. And we're going to have to learn how to help people feel engaged in and out of meetings that are, you know, we might have meetings where people are, some are in the room and some are not. How do we do that and help keep people feeling good about the work that they're doing and the people that they're working with and just everything that they're doing? And how do we do that? How do we do that well? That's where I see a big focus and a shift, because when it comes to social health and emotional health and all of that, I think that's where people, it's going to be different.
So with that, just as a follow, what's one thing you'd recommend that that we do to help employees be safe, healthy, and physically and mentally kind of fit and resilient during this time?
I think we have to continue to tell employees to talk to others. And I mean, all of these things that you have on the screen right now too. I mean, we want people to be safe. Don't, you know, stay safe, don't get sick, but talk to people about how you're feeling. I mean, use your resources around you. Most companies have set up employee assistance programs if they don't have them or didn't have them pre-pandemic. But I know we've seen a big uptick in our usage. And I think that's a good thing. I mean, mental health was always a negative stigma in the past. And I think we're starting to see that move to a new place. But just if you have any point in time or employees are feeling, you know, overwhelmed or, you know, they need social contact and they can't get it, like use those resources around you, use the people that you have around you to feel better.
Yeah, great advice and a great way to help us close. I think the advice here in terms of first safety, whether that's mask, wash your hands, social distancing, avoid crowds, get your shots. And then the other is we feel stress. It's not the time to bury that. Nothing to be ashamed of. Seek help and stay connected with friends, family, and professional help as you need that. That's a sign of strength. So thank you for your time this morning. Thank you so much, Wendy. Thank you, Dr. Spindel. I've really enjoyed the conversation and got a lot out of it. So be well and thrive. And the videos will be available in the chat so that you can see the videos that we provided earlier. Thanks again. Have a good day.
I'm Katie Scharf. I'm an infectious disease physician with Kaiser Permanente, and I'm here to answer your questions about COVID vaccines. I guess I would frame it to remind people that boosters are not unusual for vaccines. So many of the vaccines you got as a child, you needed a booster dose. And if you get a tetanus vaccine, you get a booster dose every 10 years. And really that's to enhance or augment that immune response so you're more protected. And so, you know, I guess I would want people to understand that this was probably expected that we would need a booster dose to really enhance our immune response. And when they're offered, I would recommend, that people go ahead and take them. I'm Katie Scharf. I'm an infectious disease physician with Kaiser Permanente, and I'm here to answer your questions about COVID vaccines. This question of fertility, I think, came up on social media because there was this story where they were correlating a protein that's on the placenta and saying it was similar to this protein that's on the coronavirus. And so therefore there was this false link that somehow getting the coronavirus would impact this protein on the placenta and therefore impact your fertility. There is truly no relationship between these two proteins, and there's really no impact on your fertility. And we have good data demonstrating the safety of the COVID vaccine in individuals who are pregnant and who are trying to get pregnant. And we have good data showing that individuals that did get the COVID vaccine went on to, successfully get pregnant. I'm Katie Scharf. I'm an infectious disease physician with Kaiser Permanente, and I'm here to answer your questions about COVID vaccines. We see young, healthy people getting really sick, hospitalized, and even dying from COVID. And so even if you're an individual with no medical conditions, it doesn't mean that you have a free pass. COVID gets everybody, and it really doesn't care who you are or what your past history is. This virus is tricky, and it appears to be getting trickier as it mutates and becomes more contagious and possibly causing more severe disease. And so you need to get vaccinated to protect yourself, because the virus is smart and it's gonna, mutate. And this gives me a lot of anxiety, but I worry about the next variant that's gonna be even more contagious or cause more severe disease than what we're dealing with right now. I'm Katie Scharf. I'm an infectious disease physician with Kaiser Permanente, and I'm here to answer your questions about COVID vaccines. We have really good data that the vaccine actually boosts your immunity. So if you had COVID, you might have some protection from that illness, but we know that that protection is going to drop off over time. And as we see some of these new variants emerge, there's a risk of getting reinfected. We know that people do get reinfected. And so getting that vaccine will boost your immune response, so you have that longer protection. And so yet again, as we see development of these more contagious variants, it's yet another reason to go get that additional shot to boost your immune system so you stay protected as this pandemic unfortunately drags on and on. I'm Katie Scharf. I'm an infectious disease physician with Kaiser Permanente, and I'm here to answer your questions about COVID vaccines. When we think about this vaccine development, we have years and years of research into the types of vaccine platforms that were used for the Pfizer, Moderna, and Johnson & Johnson vaccine. And so the vaccines were developed very quickly, but that's because we have all of those years of research. One reason we were able to accelerate the development is because there was great collaboration between scientists around the world and additional funding from government and pharmaceutical agencies that really was able to support this quick development. These are widely distributed and some of the most scrutinized vaccines in history, and are really demonstrating a great safety and efficacy track record. I'm Katie Scharf. I'm an infectious disease physician with Kaiser Permanente, and I'm here to answer your questions about COVID vaccines. The COVID-19 vaccine, if you were to be one of those individuals who has a breakthrough infection, you're going to have mild symptoms. So what we know when you get the COVID vaccine is that it prevents severe illness, hospitalization, and death. And those are really important things, because we don't want you to have severe illness or be hospitalized with COVID-19. It's critically important that we get everyone vaccinated here in the United States and throughout the world, so that we can stamp out this disease and not have these mutant viruses that are going to cause more severe disease or even no longer respond to the vaccines down the road.
Why do I love being a doctor at Kaiser Permanente?
Our team of doctors, dentists, and specialists all work together to provide comprehensive, coordinated care.
I can see your electronic health record across Kaiser Permanente.
I'm proud to be a part of the team that represents Oregon's highest rated heart program.
And belong to one of the largest cancer clinical research groups in the country. Doctors are empowered to do what's right for the patient. And I'm a patient too.
Welcome to this world. You have some big shoes to fill. People will tell you what to eat. Everyone will have an opinion.
Higher, just hold your head a little higher.
And yes, there will be tears. Lots of new introductions.
4 ounces, that's a good sign.
Sleepless nights.
That's normal. Okay.
So many new toys. It's not going to be easy, but together we got this. Kaiser Permanente. Thrive.
The x-rays from your urgent care visit look good. Just stay off that leg, okay?
What about my rec team? I'm all they got.
Next season.
Thanks, Doc. Wow, you already scheduled my PT. I love doctors who work with athletes.
Does he know you tripped over a basketball?
That's a sports injury.
At Kaiser Permanente, we make getting care easy so you can get back on the court quicker.